Getting a brain MRI. What could go wrong? I needed the scan, but it showed abnormalities that were worrisome, and I was left with uncertainty and fear. I learned several lessons from my life and perhaps yours. Hi, I'm Dr. Bobby Du Bois, and welcome to Live Long and Well, a podcast where we will talk about what you can do to live as long as possible and with as much energy and vigor that you wish. Together, we will explore what practical and evidence-supported steps you can take. Come join me on this very important journey, and I hope that you feel empowered along the way. I'm a physician, Ironman triathlete, and have published several hundred scientific studies. I'm honored to be your guide. Welcome, everyone, to episode 33, Brain MRI. What could go wrong? Well, in past episodes, like number 12, to test or not to test, we talked about screening, where you might get one of those hundreds of blood tests or a total body MRI scan. And the goal there was to try to find if there's any disease really, really early before you get symptoms and to try to intervene. Now, this sounded good, and I talked about it in the podcast, but there are problems with false positives, where a test is abnormal, and that may lead to a lot of anxiety, further testing, and even complications. Now, I have my own story to tell and share, and I think there's some lessons for me, and I think maybe some lessons for you from what I experienced. So let's begin with my story. Now, this is not about a screening MRI scan. This was not something that I was like, well, maybe I should just do this to see what might be there. I woke up a couple months ago and the room was spinning. Now, I wasn't lightheaded. It was truly spinning. And as I would get out of bed for about 30 seconds, everything would just be spinning in circles, and then it would go away. But I had kind of a low-grade headache, almost like a hangover during the course of the day. Now, when this comes on suddenly like this, the most likely cause, it's what's called benign paroxysmal positional vertigo. It's a long name, but basically it has something to do with what's going on in your inner ear, and there are little crystals in there, and sometimes they get into the wrong place, and that can cause the problem. And it usually resolves in a few days or perhaps a few weeks. Well, several months went on, and it was still there. And I was like, this isn't normal. This doesn't seem like the benign positional vertigo. I wonder if there's something more I should be aware of. So I went to my primary care doctor, and he and I thought that getting an MRI scan made some sense. Now, as I titled this, what could go wrong with an MRI scan? Well, as I walked in there, the technician said, well, do you have any metal in your body? Like a foreign object or an artificial joint or a pacemaker. And I had this image that if I had one of these things with the magnet in the MRI scan, and it's a huge, powerful magnet, all these things could come flying out of somebody's body, which of course would be rather dangerous. And what I learned was, no, I don't have any metal in my body, but if I did something like that, they aren't going to come flying out of your body, but they could get dislodged a little bit, and that wouldn't be ideal. And so, of course, you want to tell people at the MRI scan place about it. Well, I live in Austin, and everybody and his brother has a tattoo, and they ask you about tattoos because I guess some of the tattoo paint may have some metal in it. And no, the tattoos are not going to come flying out of your body. Again, that was the image I was thinking. But the tattoos and some of the metal can distort the image, and so it's very important to tell folks about that before you go into the scanner. Well, back to my story. That was just a little bit of a detour. So I went and did the MRI scan, and doing the study was pretty uneventful. Now, they talk about what are called open MRI scans. And this means that, the head of the scanner and the foot of the scanner are open. But when you're actually doing it, you're in a tube. Even though the tube isn't closed at one or the other end, you're in a tube. And for some people, it can cause some claustrophobia or feeling uncomfortable. Now, as we learned in episode 5 about mind-body harmony and meditation and breath work, that's what I did. I closed my eyes while I was in the scanner, and it took 15-20 minutes, and was able to meditate. And if I had any anxiety about being in this narrow tube, the breathing and the meditation helped me a lot. So if you ever need to do an MRI scan and this is something you're a little uneasy about, maybe try some breath work or meditation. Okay, so the results. Now, what was remarkable is that when you leave the MRI scanner area, the technician says, well, this has to be reviewed by the radiologist, and you'll get results in the next 1 to 2 days. And it turns out, at least in Texas, I don't know if this is absolutely true everywhere, but once the radiologist has completed the report, in the old days, they would send the report to your doctor who ordered the test. The doctor would review that, and then it would be released to you, the patient. But now, apparently the laws are, at least here, that they have to release the results to me at the same time as they release it to the referring doctor. So before I got to my car, I looked at my email, and lo and behold, there was the report, which was unbelievable that I got it within probably 10 or 15 minutes. This is all now electronic, so presumably they sent the MRI scan to some remote location where the radiologist was just sitting and available, read the report, and within 10 or 15 minutes I had it, which is quite remarkable. Okay, so the good news is that when I read the scan results, there was no evidence of a tumor. There was also no evidence that might explain the vertigo. And here's the kicker. They wrote on the report the following: chronic microhemorrhage in the left frontal lobe, white matter. Now, obviously, there's a lot of gobbledygook here, and you probably don't necessarily need to worry about, what exactly it said. But chronic microhemorrhage. Now, that can't be good. As I was reading this, I'm saying, this can't be a normal thing, and I'm not sure I'm happy about hearing I have a chronic microhemorrhage in the front part of my brain. And this also brought to memory my brother-in-law, who at a young age had frontal lobe dementia, which was quite devastating on the family. And so this brought to mind, could this lead to something like that? All right, so now I'm thinking about this as I'm driving home in my car. Of course, as soon as I get home, I have to start doing my scientific homework. What is chronic microhemorrhage? What does this mean? And I found review articles, and I found, primary studies, and, reached out quickly to my primary care doctor. And again, he didn't know definitive answers about this either. So what did I do? And this may be a lesson for you. I started a list of questions because I knew ultimately I was going to have to see a neurologist. And so this was the beginning of get ready for that visit. First question, what does it mean? What does it mean to have chronic microhemorrhage? Secondly, what causes it? And I learned that it could be high blood pressure, and I have high blood pressure, which has been treated well, but maybe that caused it. And then there's something that worried me more, and it's called amyloid angiopathy. Now, when you hear the word amyloid, you think maybe Alzheimer's disease. So now I'm worried that potentially this puts me at significant risk for Alzheimer's disease at a young age. Now, all of these specific questions are not ones that are probably going to apply to you, or hopefully won't apply to you, but the process of asking these questions, and I'm just giving you these as examples as to what you might do if something like this arises. So as I was reading about amyloid angiopathy, which is basically a blood vessel problem due to the amyloid, I was asking questions, does it increase my risk of dementia? The answer is yes, several-fold increase, it appears. How common is finding something like this at my age? And if there are chronic microhemorrhages, how do I reduce getting more of them? Because clearly more of them can't be good. I was on low-dose aspirin related to my cardiac risk, and should I stop the low-dose aspirin? All right, so these were some of the questions that I was starting to wrestle with. Now, over the next number of days, there was an emotional impact. So I'm very healthy. I follow the 6 pillars. Of course, I talk about them with you, so of course I have to follow them. And you realize, well, look, bad luck happens, even when you're healthy or appear healthy, and even when you're doing all the preventive care work that you can do. So maybe this is something that was my bad luck. And then I began to sort of reflect on, well, I'm not going to die tomorrow from this, but it could mean that dementia strikes in some number of years in the future, not 20 or 30 years, but maybe over the next 3, 5, 7, 9 years. And what if I only have those number of good years left? Am I approaching life how I would like to? And I basically felt, yes, the life I have running the exotic animal ranch and the bed and breakfast, and then, of course, working with you, my audience, with the podcast and with coaching. Yes, I think I am living my life like I would like to. I love my wife. I love my family. I appreciate them. So that part I felt pretty good. But then I was like, things like, well, I've saved money over the years. If I had a more limited number of future years, would I do anything different? And my wife and I have been talking about going to Europe. And I'm like, yeah, we're definitely going business class. There's no reason to not at this point in our lives, whether I'm destined to have dementia in the near term or not. Let's make that decision. All right, so these were the questions that I had queued up. This is some of the emotional impact that I was facing. What do I do next? Well, clearly the next step was to see a specialist, in this case, a neurologist. So this is something that many of you will face, which is in many, many cities, increasingly, to see a specialist can take a long time. It can take months to get to see the specialist you really, really want to. So I had a discussion with my primary care doctor. Do I wait for the special neurologist at the academic center who might be the most expert at this issue of chronic microhemorrhage? Or do I find a neurologist that's more available? Maybe not on the, 10 best neurologist list in the United States, but I was thinking, this has got to be a relatively common question that comes up, and any good neurologist should be able to help me at least take things the next step. So we chose, my primary care doctor and I, to go to a neurologist who had availability quickly for me. And I was able to schedule to see him within a week, which was really quite remarkable. On Tuesday, I had the MRI scan, and as I said, 15 minutes later, I had the results. And then within a week, I would get to see a neurologist who could help me begin to understand what the journey was ahead of me. Now, if you've listened to episode 20, Do You Like Your Doctor? I walked through a whole series of things about how you judge your relationship with your doctor and ways that you might make it better. By all means, listen to episode 20 if you haven't, or if you'd like to refresh your memory. And so there were a whole lot of things I was thinking about as I was going to visit the neurologist. And as it turned out, he checked off many of the boxes of things that are very important. He saw me on time. He took time in the exam room. He answered questions. When there were some follow-up questions, I could email through the portal, and he had referrals that made sense. Well, what did I learn? Well, the good news is I am a physician, so it was very, very helpful to walk through the MRI scan together in detail, because what I got from the radiology department was just a written report. Didn't really give me a detailed sense of what was there. So we walked through each slice of my brain, slicing it top to bottom, side to side, and every other which way. And it turned out there was a little microhemorrhage in the location where they talked about. It was very small. And then there was a thing in another part of the brain that might have been a microhemorrhage or could have just been a blood vessel that we were looking at. So the first lesson that came out of this is that looking at the scan was way more illuminating with my doctor. Of course, I wouldn't be able to understand the scan myself, than the report. And in hindsight, that report should have been more precise about how many microhemorrhages were there. Was this something they commonly see in doing thousands of these MRI scans? That all ideally could have been included in the report. And since these reports go to the patient right away, even more important. Obviously, the radiologist has to be cautious about what it means, but there's a few things they could have said that would have just clarified things a lot. So in talking to the neurologist, I said, look, this is my scan. Is this something you see commonly as folks age? And he said, it's really not uncommon. Doesn't mean it's normal, but what he saw did not worry him. He said, look, this kind of thing does pop up. And he said, there's no indication that this little microhemorrhage puts me at great risk of dementia. And this was the good news because, as I've talked about, when you do a screening test, and again, this wasn't a screening test, you want to reassure yourself that there's no evidence of early disease. So I took this as an opportunity to say, well, I got the scan, and obviously I got this abnormality we're not happy about, but let's take a look at the brain more generally. And what do you think of the brain? And he said, look, it looks great. There's no evidence of thinning or shrinkage or all the things that you think about when you look at an older person's brain as indicators that maybe there's early dementia. And none of that was there. So that was very reassuring. And then we got into a discussion about the level of blood pressure that would be ideal to reduce our risk of stroke. And he said, well, if you keep it under 135 over 85, that's really good. But I said, well, my understanding of the literature is that if you can get it down below 120, that's even better. And he said, yeah, you're right. That's true. But for most people, if you try to lower the blood pressure that low, people will get dizzy. So although statistically that's what you want to do, for most people as they get older, their brain needs a higher blood pressure to keep all the blood flowing in the brain. Now, for me, getting below 120 doesn't cause symptoms. Of course, if it drops below 90, I do start to feel a little dizzy. So that made me feel good that I guess my brain was doing well, that it could tolerate a somewhat lower blood pressure. So I walked into my neurology visit with a lot of fear, a lot of concern about what this means and my future. And for me, I was very fortunate that I left the neurology office feeling even better about my brain than before, because it was clear I didn't have a brain tumor and not likely to get one in the next year or two, because these are often slow growing. And that the brain looked good and healthy and no early signs that maybe something's going on. All right, so now I'm left with the most likely diagnosis that I, in fact, have that benign positional vertigo, even though usually it's gone within, days, weeks, or up to a month. Yes, after 2 months, I did have continuing symptoms. But the good news is, actually, between the 2 months and 3 months, it finally did pretty much go away. But you have to ask yourself the question. I asked myself the question, but I don't want the vertigo to come back. What's the likelihood it will? And this is true for all sorts of illnesses. You want to know, is it going to come back? Well, there's about a 25% rate of reoccurrence in the next year. So, of course, I asked the question, can I reduce that risk? So, went to the literature, and it appears from some studies that vitamin D can reduce the risk. Oh, great. So let's take vitamin D supplements. But, and this is why it's so important not to get carried away with studies without reading them more carefully. The only time vitamin D helped for these vertigo patients was if your vitamin D level was already low. Well, that kind of makes sense. If it's low, maybe treating it could make it better. Well, in my case, my vitamin D level is just fine. So there's no reason for me to take vitamin D, and some reasons we can talk about at a next podcast about why you don't necessarily just want to take vitamin D, especially at higher doses, for no reason. And it turns out, if you have this vertigo problem, there's some really good physical therapy they can do. Basically, it has to do with lying you down and turning your head in certain positions. And the vertigo can be resolved within 1 session, maybe 2 sessions. But generally, you can really do a good job by doing that. And so, even though I don't know how to prevent it, I now know if one of these episodes pops up, I'm going back to the physical therapist. Now, this is a special physical therapist that focuses on balance and dizziness, that I know what to do for the future. And here's something that I didn't realize is possible. Maybe I don't, I have a referral to the physical therapist, and those are good for a year. But I'm like, well, what if I get this episode again 18 months from now? And what the physical therapist said to me is, what you can do on a yearly basis is ask your doctor just to put in a referral, even though you don't need it. And that referral will be good for the next year. So if anything happens, I don't have to reach out to my primary care doctor, wait for them to make the referral get to the physical therapy place. It can be like a standing order, and it will always be available to me. So if you have recurrent episodes of back pain or something else, this could be something you just keep in place so you're ready if a problem occurs. All right, let's sum things up. This was an episode I wanted to share with you because there were lessons learned by me, and maybe lessons that would be helpful for you. First lesson. Even a test that you need, in this case the MRI scan, which was clearly indicated after several months of symptoms not going away, even a test that's needed can send you down an anxiety-ridden rabbit hole, because it may come up with something that doesn't explain what's going on but could lead to worry. Second lesson. When choosing for me when to see the neurologist and whether to go to the super specialist or somebody who is more available, sometimes quick answers beats the super specialist answer. So waiting 6 months would have led to a lot of anxiety, a lot of uneasiness. And in the end, I would have learned from the super specialist that, yeah, it's not something to worry about. So for me, getting that answer within a week was really important. Now, I could have always seen a second neurologist from a tertiary care center after that. So for me, and this is something to keep in mind, maybe you just want to find somebody that's relatively available and then see how that goes. And if you still have uncertainties, by all means, then go to the next tier of specialist. But for me, that quick approach, which gave me an excellent set of answers, really was wonderful rather than waiting 6 months. So I hope you don't get a worrisome diagnosis. As we age, probably we will at some point, but perhaps my journey might be helpful for you and give you some ideas about how you might address it. Let me know your story if something like this has happened, and maybe I can share that with our listeners and help all of us. Thanks so much for listening to Live Long and Well with Dr. Bobby. If you like this episode, please provide a review on Apple or Spotify or wherever you listen. If you want to continue this journey or want to receive my newsletter on practical and scientific ways to improve your health and longevity, please visit me at drbobbylivellongandwell.com. That's doctor as in DR, Bobby, livelongandwell.com.